Hello guys, today I'll be walking you through the entire abdominal examination. We'll start with the very basic and then we'll try to interpret each and every individual component. The very basic of the abdominal examination is to know your quadrants first. The word quadrant itself is telling you there are 4 quadrants in the abdomen, but how do you actually make them and learn about the quadrants? In order to make the quadrant of the abdomen, let's look at the anatomical landmark. The first anatomical landmark is going to be your xiphisternum. So you mark your xiphisternum. So this is where I have marked my xiphisternum. This is in the midline. Then you go and palpate for your pubic symphysis, and this is the pubic symphysis that you have marked. Now from the pubic symphysis to the xiphisternum, I am now going to draw a line that passes through the umbilicus, and this is your vertical line. Next line that you're going to draw is going to be a horizontal line that is going to pass through the umbilicus. The only criteria that I have is this line should be perpendicular to that of the vertical line. Now once you have drawn this line, now you can see beautifully there are 4 quadrants of the abdomen that are formed. Let's label those 4 quadrants as well. Now the first quadrant that you see, this is the right sided in the upper region, so it's an upper quadrant, so it's a right upper quadrant. Then you have the left-sided upper quadrant, this is the left upper quadrant. This becomes the right-sided but the lower quadrant, and this becomes the left lower quadrant. This is how you divide the abdomen into 4 distinctive quadrants: right upper, right lower, and the left lower. Once you know your quadrants, one confusing term that we'll use is the regions in the abdomen. Let's look at how do we divide the same abdomen into various regions. Now that we know how we divide the abdomen into various quadrants, let's see how do we divide the abdomen into various regions. In order to divide them into regions, you need to know 4 lines, 2 vertical and 2 transverse lines. Let's look at the anatomical landmark for the vertical lines. The 2 vertical lines that I'm going to draw is going to be a mid-clavicular line. It is going to be midway between your shoulder girdle and your suprasternal notch. You mark it down here. From there, you draw a vertical line going all the way down. Right? Now, this will become your right mid-clavicular line. Same way, I'm going to mark it on the left side also. So, this will become your left mid-clavicular line. This is your left-sided mid-clavicular line. So the 2 vertical lines are pretty sorted. We know how to draw it. There's no problem. The problem is your transverse line. Now, the lower transverse line that you're going to draw, you're going to feel this bony landmark. This bony prominence that you're able to feel, this is your anterior superior iliac spine. Now, whenever we pick any bony landmark or any landmark which is going to be anatomically relevant, the only criteria is that landmark should be fixed irrespective of the position of the patient. Now, once you have taken the ASIS on one side, this is the right sided, you will palpate the ASIS which is there on the left side. There is your anterior superior iliac spine on the left side. You draw a line connecting these 2 anterior superior iliac spine. Now, you got your first transverse line. The second transverse line, if you want to measure it, there are very precise measurement that I want to tell you. Palpate your suprasternal notch. So this is your suprasternal notch. This is your suprasternal notch. And here you see this is your pubic symphysis. This is your pubic symphysis. Now what you have to do is you have to measure the distance between the pubic symphysis and the suprasternal notch. Right? So let's look at the measurement from here. So I have a tape, always have a tape which is quite handy when you're doing a clinical examination. Measure from the suprasternal notch all the way to that of the pubic symphysis. So I am getting the pubic symphysis at 50 centimeter for this patient. Midway between these two, that is from the suprasternal notch to pubic symphysis, the midway of 50 is how much? I mean, we all are doctors, I know maths is a bit difficult, but if you look at this, this should be at 25 centimeters, which is here. You can see this 25 centimeters. So this is the midway, this region. I'm going to mark the point here, which is at 25. Right? Now this is your second transverse line. So I'm going to draw the line that is going to pass through this region. And now you have your regions in the abdomen. Let's mark the regions which are going to be present. Now when you're looking at the region, now what do you have? So this is what we call it as the epigastric region. This is the umbilical region. This happens to be the hypogastric region. So epigastric, umbilical and hypogastric. This is your right hypochondrium. This happens to be your left hypochondrium. This is your right lumbar region. This happens to be your left lumbar region. This is your right iliac fossa. and this happens to be your left iliac fossa. Altogether, all 9 quadrants or all 9 regions are right in front of you. So the 4 quadrants and 9 regions, and this is how you divide them.